Okay, well, I thought I'll take a minute and I'll tell you a little bit about my books. This is my latest book. It's called Vital Vision, and I wrote it based on questions that I was getting on social media. And so it has some really good recommendations on nutrition and myopia and astigmatism, cataracts, macular degeneration, floaters. So it's called Vital Vision. All these books are $20, so I can autograph them for you. This is called I Sense, and this was a book I wrote a few years ago. And the book really talks a lot about something called Biofield analysis. So I'll talk about that in a minute, but also light therapy, continuum movement, craniosacral therapy, aromatherapy. I'm an aromatherapist, so I have different essential oil protocols, and my work with Dolphin-assisted therapies, which I'll talk about in a minute. This is the first book I wrote in 1994. This is a new edition, Creating Your Personal Vision. And this has a lot of great exercises in it. There's a lot of exercises and charts in it. And it's probably my signature book. It's really good. So I wrote that a long time ago. Taking It In, this is about diet and nutrition. I was getting a lot of questions on what foods should we eat. And for example, what vegetables are good for our eyes? Asparagus because of glutathione. Kidney health, avocados, lutein for macular health, beets, really good for the liver. And I'm going to talk about a smoothie formula I use when we talk about iridology, but beets are part of it. Blueberries, very good for night vision, low glycemic index. Carrots, obviously high in vitamin A. Goji berries, very good for macular health. Pumpkin seeds, because of the zinc in it. And so anyways, there's lots of different things in this book called Taking It In. And then working with kids, I wrote a book called Treating the Whole Child, From ADD to ADHD Revolution. And if you know somebody who's got a child who's struggling, this could be a really good book for you. I have been affiliated with an institute in Albuquerque for many years called Kid Power. Kid Power Associates is a group of occupational therapists who are very forward thinking, and they have a clinic in Albuquerque. I think there's a 2-year waiting list. And so I come in as the eye specialist, of course, but I'm working with the whole body, and we work with different sensory movement activities and all kinds of brain stimulating activities. So this book on treating the whole child is my compilation of working with the pediatric population for many years. So I bookmarked Biofield analysis. I'll start with when I first moved to New Mexico, I met a woman named Dr. Hazel Parcells. Some of you have heard of her. Dr. Parcells was a naturopath and a chiropractor in Albuquerque, and she was an amazing healer. And when I was writing my book, Creating Your Personal Vision, I called her up and asked her if I could interview her for the nutrition part. And so she said, well, you've got to come out to my retreat center. And at that time, it was in north of Las Vegas, New Mexico. When I got there, she took a look at me and she said, oh, your parathyroid is off and you've got parasites. And I thought I was pretty healthy, right? She just looked at me from across the room. I said, I want to be a student of yours, right? So we became very close, and for 104, that's when I met her. And so for 2 years, I shadowed her. I went to see her a lot. So I learned her methods. And one of the methods I learned was treating people from a distance. And this gets controversial because, there's a form of this called radionics. Has anybody ever heard of radionics? It was Malcolm Ray, R-A-E, was one of the people who did that. So basically, it's taking a witness from your body, could be hair, could be blood. Okay, so that's your energetic blueprint. And through pendulum and asking the right health questions, you get energy readings on all the parts of the body, and then you broadcast healing energies. It could be homeopathy, it could be color therapy, lots of different things, but the person doesn't need to be in the same physical space. And a lot of people have a hard time with that, especially in the medical world, because in the medical world, you got to be in the office, right? If I'm not in the office, I can't do my work on you. But Dr. Parcells and people before her, she had clients all over the world that she would broadcast, that. So that, I believed it, I could do it, it was wonderful, but I also wanted to measure it. And so about 7 years later, there was a conference at the Transformational Psychology School in Santa Fe, and there was a Russian biophysicist there who was presenting. His name was Konstantin Korotkov. Anybody ever hear of him? No. So Dr. Korotkov had this instrument that could measure your energy field and your chakras, and you could actually see it on the computer. And so the way it worked was he had this special camera he studied with Seymour Curlian. Maybe you've heard of the Curlian camera, where you would go to a health fair, put your hand on a cradle, and they would take a picture, and you get a picture of your aura. So what Korotkov did is he took the technology of Curlian and he quantified it because he was a scientist. And the way he did that is he would have you put each of your fingers on a camera lens, that he designed, called a GDV camera, gas discharge visualization technique. That's going to be on the final exam. No, it's a camera that you put each of your fingers, and there's a photon emission. There's a little light spark that creates an emission on the fingertip because we're all emitting light. We're all light bulbs, right? And Dr. Parcells used to say, if you clean up the inner environment and the energy field, the physical body will heal. So this camera was amazing, and I ended up buying it. I became a colleague of his, and I actually presented at his conference in St. Petersburg, Russia in 2011. Because the other part of the work that I did was so when I studied craniosacral therapy and I got done with that training, I was also very attracted to the energy of the spinner dolphins. And so I went down to Bimini, Bahamas, and I took a group of my traumatic brain injury patients who I'd been working with, and I'll talk about the trauma work in a little bit. So I took them down there and was at a retreat center, and what we would do is go out and swim with the wild dolphins every day, and we would do craniosacral in the water, and we had amazing healings with people. It was just, but that was 2007, and the last year I went there, and so the I Sense book talks about this. There was a hurricane, because it's Hurricane Alley, especially August, right, in Florida and the Bahamas. So we did meditation, and I think the hurricane went backwards and missed us. The power of the mind, right? So anyway, I was kind of burned out about the hurricane thing, and I'd always had a kind of a spiritual home in Hawaii. I started backpacking there in 1990, and I would go every year, once or twice a year. So I met up with a boat captain and some other people in Hawaii, and so I started bringing groups to Hawaii in, I think, 2011, 2010 maybe. So I brought the camera on the boat, and we would measure people before and after the dolphin swims. So each day we did 4 in our retreat. So when they would first come, their energy fields were totally erratic. There were holes in the field. There was all kinds of dissonance. And by the end of it, the fields were so bright and clear, and the chakras lined up. And so that was the research I presented at Dr. Korotkov's conference. But the wild spinners in Kona, in the Big Island, that was a great place. We had a group where I would go every year. We had anywhere between 10 and 25 people where we did dolphin swims. And my last retreat was 2020, January, right before COVID. And so once COVID hit, the government, NOAA, came in and said, there's too much interaction going on between humans and dolphins. And part of it was, I think, really true, because what was happening is more and more boat operators were getting licenses, and so it was getting very congested out in that sanctuary, and they didn't regulate it very well. But the bottom line was that ended the dolphin swims. But that's okay. I mean, we had so many amazing healing experiences with them. One time we were in the water, and the dolphins never would touch you, but this dolphin actually slapped this guy like on his lungs. And I was like, oh, you need to go home and get a scan. And he had a tumor in his lung that he had taken out. We had women on there who were either pregnant or had had miscarriages, and the dolphins would just go around them. And we had one guy that was shot down in Vietnam, and he had been in the water for 24 hours. And he was afraid of swimming in the water. So we got him in the water, my staff and I, and the dolphins just kind of surrounded him. And it was amazing, healing. So there were so many of those on every trip. Someday I'm going to write a book about it. But in any case, now when I go to Hawaii, it's just a pleasure. And I do go to Kauai now, and I do have a boat captain, and we go out, but it's hard for us to get in the water because the Coast Guard's there, and it's really difficult. And the whales are also a big part of it as well. So when you go in the winter time in Hawaii, because of the humpbacks, you get their songs and sound. You know, if you happen to be in the water and they come over, that's fine. You know, so we've had so many experiences with that. Anyways, the iSense book talks about that, and that kind of is the GDV camera and all that. I want to talk 1 minute about aromatherapy. So essential oils are really great for the eyes. And I actually, it's funny, on Facebook, when I did a post on frankincense, we got over 1 million views. That's how much people respond to frankincense. You probably know. Yeah. So you can take frankincense and massage it on the back of your neck. You can massage it on the temples. If you're going to dilute it in a carrier oil, a good formula to protect your skin would be 1 drop of frankincense in 1 tablespoon of carrier oil. That ratio. And I use it directly on my skin, but I do a test patch. I test on my wrist here, and if I don't get any skin issues, that's fine. But certainly it's perfectly okay to use a carrier oil diluted. The other one is my famous eye protocol. That's another one that got a lot of views, and I've used it for years, so I'll give it to you. It's using fennel or sweet fennel. That's number 1, and that's good for the lymph system. It's good for digestion. And where you place it is on the hairlines up here, look here, and then out here on the temples, and then at the cheekbones. Okay, so here, here, and here. And then the second oil I put right on top of it is carrot seed. So carrot seed has a lot of vitamin A, it's got a lot of vitamins and minerals, it's great for the eyes. Then the third one is frankincense. And if you can tolerate that layering, you'll notice immediately how much more peripheral vision you have and how much more relaxed your eyes are. And if you do it for 30 days, you will get a sizable improvement in your eyesight and vision. Okay, so again, I'm not affiliated with any companies, but I'll share the companies that I use personally, but I'm not involved in anything on products. One company is called Lotus Garden Botanicals. Lotus Garden Botanicals. And I like them because they test their oils and they put the results, like when there's an expiration date, and they're very honest, as far as I can tell, meeting my safety standards about purity, organic, biodynamic farming, no multi-level marketing. It's kind of a boutique company, and you can get samples, like 1 ml samples for like $5, you know, so if you want to try it out. The other company is in Sedona, and their name is Still Point Aromatics. Still Point Aromatics. I know the women, they were in my aromatherapy group way back when, and they went off and they started their own company, and they're very honest in what they're doing. But I do want to add one other thing, and that is, does anybody know what a hydrosol is? So hydrosol is like a mist of the essential oil. So I went through a period where I actually would collect sage up in Taos, and I would distill my own oils. I'm not doing that right now, but whenever you have the plant and you heat it up, that's what you do, steam distilling. Part of the plant is releasing the oil, and part of the plant through the vapors is releasing water particles and the oil, and that's what makes the hydrosol. So they're set in two separate places on the distiller. The thing about the hydrosol is you're going to get the energetic of the essential oil and the fragrance without the cost. So let's say you love rose, okay, like rose essential oil. It's going to cost you a couple $100 to get a bottle. But you can get a hydrosol of rose for like $26, and you can use it on your eyes. You can spray it, and it's good for dry eye. It's good for hydrating the eyes. So there's a few of them that you could look at based on what you like. There's jasmine, if you like that. There's neroli from the orange peel. There's rose. There's something called helichrysum. Has anybody ever heard of that one? So helichrysum is great for the skin. Really good. In fact, it's the number one for healing skin stuff. Helichrysum, and it's spelled HELICHRYSUM. I have had a number of patients use essential oils to avoid dermatological surgeries, precancerous things, so they're very powerful. And especially if you get them from a really high quality company, they're like shamans in a bottle. And I travel with them, so if I have a little it's so funny. I had this family come to see me from New Jersey, and the boy has had terrific vision problems, and he's dizzy, nausea, he must have had some bad food. I had basil essential oil, and I gave it to him in some water. Within 10 minutes he felt fine. So basil is great if you've got an upset stomach. Just put it in water. Fennel is also good. If you feel like a cold is coming on, you could take a eucalyptus oil, put a couple of drops on your hands, and do an inhalation. Okay. If you want to get even more extreme about it, you can heat up water, put it in a bowl, put some eucalyptus in there, cover with a towel, and do inhalation it'll open up your sinuses. Really good. Tea tree is very good as well. Those should be in your basic first aid kit, and lavender if you like that. Some people love lavender, some people don't. But lavender is like an ibuprofen, especially spike lavender. Ibuprofen. Like the dolphin stories, I've read so many stories about aromatherapy and how it's stopped the bleeding. It's good for shock and trauma. It's great if you've got respiratory, digestive, even for brain. The frankincense, massaging it in the brain is really good in the head area. So I think that if you're open to it, and I used to teach a lot of classes, but I haven't taught lately. But if you want a class, let me know and you can get a group of people together. I am in Tasuki, and I have built a geodesic dome, and that's my optometry office. And I'm just for July, I don't know how this happened, but the New Mexican called me and said, "We want to interview you about your geodesic dome." I was like, okay, is this the county or? But anyways, it's a healing space, and a very healing space. And I used to teach a lot of workshops there, but I haven't lately. But if you want a class in aromatherapy, and you have a group. So that's the crash course of aromatherapy. Any questions?
You mentioned frankincense.
Yeah.
On the neck, what does that do?
Well, it relaxes your cervical spine, so the cervicals, which directly affect astigmatism, and also the flow to the eyes. So it improves circulation, it's going to reduce inflammation, and it can improve eye circulation. So you're not putting it in the eyes, you're just putting it kind of around and then in the back of the neck. You also probably get relaxation from it. Yeah, if I can get it. It's kind of hard to get right now, but yeah, I think Eyebright, again, anti-inflammatory, lubricating, soothing, Another tea we'll use sometimes for the eyes is red raspberry leaf. Herbs, etc. are closed, but a couple of other places you can get them. Any other questions about herbs or essential oils? So I want to move and I want to talk a little bit about trauma and our eyes, our brain, and our body. So just a brief story. My first go around in a practice where I started was in Philadelphia. That's where I went to school, and so that was in Pennsylvania. I affiliated with a holistic optometrist named Ellis Edelman, and I had a really hard time getting patients because Philadelphia has like 5 ophthalmology medical schools, very close by. And when I started practicing there in 1985, so it was very conventional. So I couldn't get any patients, and I went to one of the local hospitals one day to the outpatient, and I talked to the physiatrist and some of the doctors there, because they had all these outpatient people with balance issues and double vision. memory problems from either car accidents, stroke, brain and aneurysm, all kinds of things. And I said, well, I have this physical therapy I do. I think I can help these people. So they said, well, why don't you come for a month and see if you can make a dent in this? And about 6 weeks later, all their patients were gone because they all got better. And so they gave me a contract at that hospital and then like 3 others. And that's how I started to get patients, through the hospital and the traumatic brain injury. And then I wrote a book and articles about it, trauma in the eye, soft tissue, and how it affects like these symptoms that occur later based on, blurriness and mental fogginess and double vision. That's a big one. Balance issues. So working with trauma and then studying craniosacral and also Emily Conrad's work, continuum movement, I really began to understand trauma as a fight, flight, freeze experience. And we freeze our eyes. And freezing your eyes, and you don't even know your eyes are paralyzed. You don't even know they're frozen. And then your peripheral vision starts to collapse and it narrows in. And so those things, and then depth perception is another one. Do we even know we have depth perception? Are our eyes working together? And then finally, the cognitive skills, visual memory, and those things. So color therapy is really good, which I'm going to show you this afternoon. But there's some really cool things that I do with trauma and vision. And this gets to a fun part of our time because we're going to do some experiencing now. So I'm going to set the stage, by talking about glasses for a minute. So you've all been to the eye doctor, and you've probably been behind the machine that the doctor will flip, which lens do you like, number 1 or number 2? And you're like, oh, they both look the same. Is this a trick? And let's say you're having a bad day and you get, lens number 1, and you go, how come the world is like a fishbowl? How come the world is tilted? And what do they say? Well, get used to it. So astigmatism, nearsightedness and farsightedness. Let me talk about that for a second. In nearsightedness, that's where you can't see far. You take your glasses off and you go, I can't see far. That's a nearsighted person. You pull the world in, you tighten up, you blur it out there, and so the doctor gives you a lens to fix the blur out there, which is a symptom, answer. But it's based on tension and tightness and pulling in. Farsightedness, magnifiers, is the complete opposite. You've lost the agency in your eye muscles and you're depending on magnification to do the seeing, so your eyes go to sleep. It's like the screensaver comes on, right? It's like, see ya. And the stronger the magnification, the worse it gets. And then astigmatism means the eye is shaped like an egg or a football. So it's misshapen. There's a warping. But what is really going on is there's a warping or a twist in the body, which creates the astigmatism in the eye. And I know this because a person would come in for their exam, I'd measure their astigmatism, I would do craniosacral therapy on them, unwind their cranium and their spine, I'd measure their eyes. Guess what? The astigmatism is gone. So the twist in the body creates the astigmatism in the eyes. Or you get astigmatism correction in the eye, which reinforces the twist that starts to occur in the body. So any lens you get based on that 1 or 2 answer is reinforcing the problem. It's not the solution in the sense that it's treating the root cause. It's just symptomatically helping you. But as you wear that, your eyes get worse year after year because you keep being reinforced and it's tighter and tighter and tighter. So a way out of that rabbit hole is, at least in non-demanding and non-threatening situations, take off your glasses. Walk without them. Go without them some. And if you do that, it kind of interrupts the downward spiral that your current prescription is doing to you. Whether it's magnification, whether it's nearsighted, whether it's astigmatism, it's all doing the same reinforcing. Now, there are glasses that exercise your eyes, that actually strengthen your eyes. Go figure, right? So now I'm going to put my hat on and you can see me as a physical therapy optometrist. Physical therapy optometrist, isn't that an interesting combination? So you've had cataract surgery. You should be doing physical eye therapy after the eye surgery. But you know what? If you mention that, it's like, they'll burn you at the stake. They will completely invalidate you because it's very threatening to their livelihood that actually you can do exercises and be empowered to improve. But you're here, so you got out. A lot of the people that go to the regular offices, it's just like a maze, like eye associates. Whether you continue to get injections, whether you get stronger glasses, surgery drugs, and needles. That's what they have to offer. So there are exercise classes. And when I was working at the hospital, I developed these, and these aren't mine. They have been around way before me, but I've just kind of developed it, so it's not my invention. I want to be clear on that. So you've probably heard of something called a Prism, P-R-I-S-M. Does anybody wear Prism here? So a Prism is something in the glasses that alters the spatial awareness. Okay, so like let's say somebody has double vision, you can put a prism on one eye to maybe force the muscles to lock in so that there's no more doubling. Or if there's eye muscle weakness, they can use a special prism that can force the eye into it. But they usually just do one eye. That's a compensation. But the prisms I'm talking about are called yoked prisms, Y-O-K-E-D. Probably never heard of them. Most optical places, when I prescribe something, they'll call me up and say, "Hey doc, did you make a mistake? We don't know what this is." And I have to calm them down and say, "No, it's not a mistake. That's what I want you to do." So each eye gets the same prism. Okay? Now, in the hospitals, what I began doing with people is I would give them the same prism in each eye. And in doing that, it would shift the world right to left or up to down. So let's say somebody had a stroke on the left side and they lost part of their vision. Like you've got something going on with the right eye, right? Is it the right eye? Yeah. So I would give you either a prism that would shift you more into the right or shift you away from the right. And what you would say is, "Oh my God, I'm seeing more. My balance is better. This is making me see more." And so what we're going to do is we're going to each experience the yoke prisms. We're going to do kind of an exercise now. So each person is going to get a chance to come up if you want to. If you don't, no harm. We don't force here. So if you don't want to just watch, that's fine. Now, in doing this, there's a couple things that are going to happen. There's some side effects. One thing is when you put them on, initially, you're going to feel a little disoriented. Okay. Now, there's something about the brain that when you give it disorientation, it creates new neural pathways, so you have to reorient yourself. And so that's a really good neuroplasticity exercise to have to do that. We're afraid to get dizzy, we're afraid to get disoriented, and we go, "Oh, I'm afraid of," like we're afraid of blur. That's another one. "Oh, I don't want blur." And yet, you want clear eyesight? Embrace and go into your blur in non-demanding situations. And there are exercise classes that you can use to practice that. So if you're nearsighted, you'd wear a magnifying lens. If you're farsighted, you wear a nearsighted lens. So you're doing the opposite. Now, this is all in a physical therapy setting, so it's not done out in the world driving or anything like that. I want to be clear on that. But anyways, I'm going to have you do a little thing where you're going to put on the prism. I'll have a chair here so you can sit. Do it. If you want to get up, you can. The faster you move your head, the more stimulation you're going to get. So my advice would be to move very gently and slowly. Don't make big moves. And then after that, you'll get up and I'm going to have you walk on a little bit of an obstacle course. Why an obstacle course? Because, okay, there is a difference between reading the eye chart at distance, which is called eyesight, 20/20, as opposed to vision, which is how the eyes and the brain and the body work together. When you go for an eye exam, they're not checking vision, they're checking eyesight, glasses, eyeballs. Vision is how we process, how we take information into our brain and trust moving our body through space, through the world. So in this particular experience you're going to put the prisms on, and walking in an obstacle course, you're going to have to visually guide your movement. So your eyes are like your GPS system. I look at something and then I move my body based on that. And so you've got the prisms and you're doing the movement. And what will happen is, it's like a 20-second thing that you're going to do. When you take them off, two things are going to be happening. Number one, you're going to have much more eye relaxation because you allowed yourself to go into a disorienting state, and you didn't fight it. The second thing you're going to notice is your peripheral vision is going to be bigger. It's going to be wider and brighter. So those are two really positive things by doing this challenging therapeutic exercise. Whether you're sitting or whether you decide you want to motor through a little obstacle course. So we're going to go around the room. You'll go first. We'll go around. We'll have you come up, so we'll have to change the camera so that